Great news, really great news. Expanded benefit changes to Medicaid, Medicare programs in 2023. The program income limits and asset limits have been greatly increased. So many people that prior to now were not able to get into Medicaid or get extended benefits are now going to be able to get them because the income levels have been increased greatly. So let's go through it. Expanded benefit changes to Medicaid, Medicare programs. What is the difference between Medicaid and Medicare? Medicaid is a federally funded program that provides health insurance, Medicaid programs to low income individuals and families, improving health outcomes. Medicare is a federally funded program that seniors and people with disabilities health care coverage regardless of income or age. Medicaid is about income, Medicare is about age. Now, Medicaid helps reduce the cost of your Medicaid benefits. In 2023, there will be a big Medicaid expansion of income limits. The Medicaid coverage program has been expanded by the Biden administration. Medicaid expanded funding is to include more Medicaid beneficiaries with lower incomes. The expansion of the Medicaid service program is now available to people with incomes up to 132% of the federal poverty level, which is about $18,756 a year for an individual or $25,272 a year for a family of two or more. Medicaid expansion in 2023. And it's a great program, and I'm going to go through this in the 222 versus 2023. Now, the Medicaid coverage program is a wonderful program to help you with your medical billing, your prescription drugs. So, accountable now also, not only was the income increase, the accountable assets for community Medicaid eligibility, including checking, savings, CDs, brokerage accounts, individual stocks, non qualified assets, annuities, cash surrender value of life insurance, and real estate other than a primary residence. So, all that is countable, but not your primary residence. But tax deferred retirement accounts, traditional IRAs, and 401ks in payout status are not counted as assets for eligibility. So that's another group of money that used to be counted is no longer counted. A Medicaid Savings Program expansion, Medicare Savings Program, or MSP, subsidized healthcare premiums for Medicaid beneficiaries. For those who qualify, the MSP covers the monthly Part B premium and the Medicare Part D prescription drug subsidy. MSPs also allow enrollment in Part B year round without a penalty, and that's a big benefit. The income limits for enrollment eligibility in the two available MSPs has also been increased. Neither MSP imposes an asset limits. All those who qualify for Medicaid under the new 2023 expanded income limits will be automatically eligible for qualified Medicare beneficiary QMB because QMB covers Part A and Part B premiums, as well as all deductibles and copays. Now, I'm telling you, that is huge. Let's say that again. The benefits now will cover your Part A and Part B premiums, as well as deductibles and copays. So a lot more people will qualify what used to be restricted only to Medicaid people. Now, the income amount for community Medicaid replacement recipients will be raised from 100% to 138% of the federal poverty level. So that means it's been raised 38%. As you can see in 22, the income for individuals is $934 a month. In 2023, it's going to be $1,563. In fact, I've had a few customers that were in what they call a spend down. And now you won't even have to do that. For a couple, in 2022 was 1,367 monthly income. Now it's been raised to $2,106 monthly income. This is a considerable increase and will allow New Yorkers to qualify for Medicaid long-term care in their home without the use of pooled income trusts. The most common source of countable income includes Social Security, pension, retirement account distributions, rental income, and income payable from a trust. This is huge. And now also, as I said before, asset expansion. The allowable asset limit for Medicaid long-term care recipients is increasing by 50% come 2023. For individuals in 22 was 16,800. In 23 it's going to be 28,134. That's 50% increase. That's huge. You got to tell anybody you know that is low income and just barely getting by that these programs are now have been increased for 23. Countable assets for community Medicare eligibility include checking and savings, CDs, brokerage accounts, individual stocks, non-qualified annuities, cash surrender value life insurance, and real estate other than a primary residence. Tax-deferred retirement accounts, traditional IRAs and 401ks and payout status are not counted as eligibility. So if you're getting income from a 401k, it doesn't count. So this is a blessing for a lot of people. What is Medicaid, Medicare health insurance? Medicaid is a state and federal program that provides health coverage and preventive services to low-income adults, children, pregnant women, people with disabilities, and the elderly. Medicare, on the other hand, is a federal program that provides health coverage to people who are 65 years of age or older, people with certain disabilities, and people with end-stage retinal disease. The federal government is expanding Medicaid eligibility for services in 2023. So if a person is disabled after 2 years on Social Security, they qualify for Medicare. Now they may also qualify for Medicaid. What are the benefits of Medicaid Medicare? The Medicare Savings Program, MSP, is a government-subsidized health care program that helps Medicare beneficiaries pay for their health care premiums. The MSP covers the monthly Part B premium and the Medicare Part D prescription drug subsidy. This program also allows enrollment in Part B year-round outside of the enrollment period without penalty. That is another huge benefit. The program also allows enrollment in Part B year-round of the enrollment period without penalty. It used to be that you had a penalty for life. Also, they changed the ruling that in 23, if you enroll late, you used to have to wait until July of that year to get into the program. Now it's effective the 1st of January. What are expanded benefit limits for Medicaid Medicare? The expanded benefits for Medicaid Medicare are as follows. 1. MSP's Medicare Savings Plan now covers the Part D premium subsidy, which helps to lower out-of-pocket costs for beneficiaries who enroll in Part D plan. Now, Part D is the prescription drug plan. 2. MSP's Medicare Savings Plans allow older adult beneficiaries to enroll in Part B year-round without penalty. This allows people to maintain their coverage even if they happen to miss the annual health insurance enrollment period. Another big item. Lastly, MSP's Medicare Savings Plan had more comprehensive health insurance for prescription drugs. This includes both brand name and generic medications as well as the preventive drugs like cancer screenings and flu shots. How will this change help more people get the health care they need? The changes to the Medicaid Medicare program will help more people get the health care they need by expanding the eligibility requirements and offering more comprehensive health. Now, as you see on this chart, Medicare, generally for people who are 65 or older who have a qualifying disability. Medicaid is for individuals, family, and children with limited income and resources. Now, The combination of Medicaid and Medicare is only if you're disabled and those other things, 65 or older, or disabled after 2 years on Social Security. Well, Medicaid is not age restrictive. How do I sign up for Medicaid, Medicare? The best way to sign up for Medicaid or Medicare is to visit your local Social Security office. You can also call 1-800-772-1213 or visit official websites of the Social Security Administration at ssa.gov for more information and to sign up. What are dual special needs plans? Dual special needs health insurance from various insurance companies provide additional Medicaid, Medicare health insurance. This includes extra coverage for prescription drugs, dental care, and vision care. In addition, these plans offer help with managing finances and finding appropriate housing and services. They can be extremely helpful to people who need a lot of assistance with their day-to-day lives. Dual special needs health insurance plans. Dual special needs plans can be extremely helpful for people who need a lot of assistance with their day-to-day lives. If you think you can benefit from a dual special needs plan, well, How Health Senior Health Corp at insuredmeds.com can help. Insuredmeds.com can help you find the right plan for you and your family. We offer a variety of plans from different insurance companies, so you can find the one that best meets your needs. Contact us today if you are newly eligible for Medicaid or Medicare or aging out of the Affordable Care Act, which is the Obamacare. You may have a special enrollment period. To learn more about dual special need plans or to sign up for health insurance, visit our secure website, insuredmeds.com, or visit our daily free Medicare webinar by clicking here or going to Senior Health Corp on our website and registering for the free daily webinar about Medicare. Text us at 845-380-5809 and we will return your call. We have to do this because the amount of robocalls, which we never participate in. Email us at bill.vargas@insuredmeds.com. Please like, share, and subscribe. Turn on notifications. I am a veteran serving veterans. I am a senior serving seniors. Again, thanks for watching, and please share, like, subscribe. Bye-bye.